I put together a presentation to explain to everyone the measures that we're taking within the office now and in the future in light of this COVID epidemic. And before I go on to explain exactly what we're doing in the office, I want to start out with a little bit of education about the coronavirus. Many of you may already know this. A lot of this has been on the news, but for completeness, I wanted to go ahead and just put together this little presentation so that we're all, on the same page. And then it'll make sense when I explain why we do what we do. One thing I wanted to show, at least in this slide right here, you'll notice the word education is very big and the word COVID-19 is small. And that is sort of proportionate as far as the importance of everything. As with any outbreak or rumor or condition, more important is the education, so that when you understand about something, then you can take more control of it. So I think the education here itself is more important than the virus with regards to going forward. So as we all know about the coronavirus, the main symptoms are fever, cough, shortness of breath, decreased sense of smell. 80%, the vast majority of people will get better without needing any special treatment. But rarely, some people can get seriously ill from this or even die, particularly those who are susceptible or have pre-existing conditions like asthma, diabetes, heart disease, cancer, chemotherapy, etc. So how does it spread? It spreads through aerosolized droplets, either in the form of a sneeze or a cough. And actually, that's why they want us to maintain at least 6 feet distance. And of course, coronavirus can live on surfaces long after the person has sneezed or walked away. In fact, it can live on cardboard for up to a day, stainless steel and plastic for 2 to 3 days. So that's why it's going to be very, very important at the end of every day to wipe everything down as much as possible. Jeremy and I have been following the guidelines from the American Academy of Otolaryngology, head and neck surgery, and we follow these instructions whether we're in the office, the hospital, the operating room, or even in our case, the parking lots. So the recommendations do change frequently. And I know over the past few weeks, sometimes we hear one thing and then we hear another thing. That's just the nature. This is all uncharted territory. So sometimes 2 or 3 times a day, the recommendations change. And we adjust accordingly as this occurs. Not only with this, but as with the financial institutions as well. So some of you may or may not know that we are now doing a lot of video visits, and we sometimes even can get reimbursed for telephone call visits. So that's how we're still trying to reach out to our patients. And with the video visits, again, it's going to be important, and we'll make another slide on this or presentation on how workflows are going to have to be done and redesigned to accommodate patients with video visits. I've been patients that we cannot deal with just strictly through the video visit. I've actually been going out to the parking lot. That's safer for the patient, it's safer for me, and it's safer for the staff as well. We've also changed a lot of our office. If we do have to bring someone up into the office, we've changed our office exam room. We're just using one room. We've stripped it all down so that there's not extra contact areas for virus to stick to. And we have sealed it off. This is the back hallway here that leads to the back door. And we've totally sealed that off, and we've put a zipper in there so that we can pass things in and out. So as you all know, look at all the stuff in our normal exam rooms. They're pretty busy, and now we've stripped it down to there for safety reasons. Personal protective equipment, we have plenty of them. Most of you will not even need any of this, but it's certainly available for those that may need it. Like if one of the medical assistants has to help me taking care of someone with cleaning an ear or a nosebleed on someone where we do not know the coronavirus status. And we have a lot of our stuff. We've taken it on the road, and we can set up an outdoor clinic if needed, even for procedures. Medicare and OSHA have relaxed guidelines so that now we can actually practice and perform procedures in surroundings that are not necessarily a healthcare facility. Okay, now, so I'm going to get specifically to our workplace and the protocols that we're using. And I've got this from directly from the Department of Labor and the Department of Health and Human Resources. And as you can see right down here, it's OSHA guidelines. So the first thing they instructed us to do was develop an infectious disease preparedness and response plan. And that's what we have done. And they emphasize the points of keeping up to date on federal, state, and specialty guidelines, which we're doing several times a day through email. Address the level of risk at specified work sites. We have addressed those. We have different work sites. We have the office, which is sealed off from any other patients. We have the allergy tent. That's a different considerations. And we also have the procedure room. That's different considerations. And then we have to develop contingency plans in the event of outbreaks, and which is what we're doing. We're in the middle of an outbreak. And they advised us to, you're going to have to make plans and take into consideration about increased rates of worker absenteeism, the need for social distancing, staggering work shifts, meaning not everyone comes in at once. Some people will come in at one time, a different shift comes in at another time. Downsizing operations, which we have done by 90+%. Delivering services remotely, that's what we're doing with electronic medical records, and other exposure reducing measures. Another important thing they discussed was cross-training workers across different jobs in order to continue operations or deliver surge strategies, surge services. For example, some of the medical assistants may be acting as a receptionist for a while. Some of the medical assistants have actually gone and become allergy injectors, for shots. And we also have to take into consideration the interrupted supply chains or delayed deliveries. Now, then the next step was to prepare to implement basic infection prevention measures. Okay, this is as far as hand washing. And of course, we all know how to wash our hands, but there's ways where they want you to spend longer time doing it. Sometimes they suggest 20 seconds or singing happy birthday. And it's about how to do each finger individually. And then it's important to rinse off and use your elbow to turn off the sink handle, and then to use the towel and wipe it off and throw it away. If anyone wants any further resources on this, I have them available, and we can provide them. Stay at home if you're sick. Okay, that's a no-brainer. Respiratory etiquette with coughs or sneezes. If you have to cough, they talk about the vampire sneeze or cough. If you don't have a tissue on you, you do it into your elbow or shoulder. But preferably, first choice is always use a tissue to cover your sneezes and coughs if one's available. We have plenty of tissues available everywhere. So there should be no reason that we couldn't do that. If any of you were to come to work and you wouldn't have one, you notify one of us immediately and we'll get you tissue boxes. Clean your hands often. We will have plenty of hand sanitizer around and available. And when needed, if you feel you need to, wear a mask to protect yourself and others from germs. We have no problems with people wearing masks. Social distancing, we will try and keep everyone maintain 6 feet of distance. So I would encourage people not to congregate in someone's office. Stand out in the hallway and have a conversation from 6 feet away. Social distancing, avoid sharing phones, desks, and tools when possible. Work at separate locations when possible. And for example, if someone calls and they say, Dr. Chris, there's a phone call for you, I do not take the phone that the person wants to hand me. Instead, I'll say, call my cell phone, because I don't want to transmit anything from me to them or vice versa. We have plenty of garbage cans and tissues available, and our housekeepers have been coming in every single night and wiping down the entire place. So next is to develop policies and procedures for prompt identification and isolation of sick people, if appropriate. At Wheeling Hospital, they are doing screening, so no one can come into the building without getting screened for their temperature. If someone does have a temperature, they send them, they'll call up to us and let us know, and that person will not be permitted to come in beyond the hospital. Then we have to develop, implement, and communicate about workplace flexibilities and protections. For example, being flexible. If someone's sick, they stay at home. We're not going to require them to have a doctor's note if they have a upper respiratory or lower respiratory illness. And we are maintaining flexible policies. For example, if one of your kids got sick, so that you could stay home to take care of them. I think we've always sort of done that, but we're continuing our flexible policies. Now, from here on out, this is the important part here. OSHA recommends that whenever we implement workplace controls, that we follow this algorithm, okay? You have to do engineering controls. Engineering controls is like the physical plant, what you can do. Doorways, windows, air circulation, barriers, things like that. Those are engineering controls. Administrative controls, those are things that are like what Dana and Missy can dictate as far as, people don't have to sit right next to each other to get the work done. They can separate out far, using instant messaging if needed, or calling down to the other person's extension. And safe work practices falls under administrative controls. And then also we about personal protective equipment, and we'll go into more detail on that as well. So I already discussed about these things to take into consideration during an outbreak, the contingency plans. So first, OSHA developed this triangle, and it's a triangle of occupational risk for COVID-19. And there's 4 different layers to this triangle or pyramid, okay? So the first one is a very high occupational risk. That's something, for example, Dr. Jeremy, Lacey, Hillary, or myself. And those are high risk or aerosol generating procedures on known or suspected COVID-19 patients, meaning we know that the person has COVID-19 or we suspect it, and it's all the precautions that we will have to take. The next is considered a high level of risk for specified work sites. And that would be like a nurse on the floor, caring for a COVID-19 patient, ambulance transporters caring for COVID-19 patients, or for example, if one of the medical assistants had to come into the isolation room and assist one of the doctors or extenders on caring for a patient that does have COVID-19. Now, medium risk classification includes people who have just general public contact, like people who work at the stores or at Kroger's. Schools, we really should take that out. And these are people who have frequent contact within 6 feet of other individuals, not necessarily COVID-19, but just any individuals in general. So these are people that are working, again, at Kroger's, at the takeout restaurant places, car mechanics, etc. Now, the lower risk, those are individuals or work classifications that does not require contact with suspected COVID carriers or the general public for that matter, and it does not require frequent contact, within 6 feet of anyone. And by far, this is the category that you will be in most likely in our office, the low risk category. The only exceptions to that would be the medical assistants who have to come with us into the isolation room, or an allergy nurse who is giving an injection. So remember, most everyone in our office will be in this purple category, the lowest risk. So, for people with lower exposure risk, and again, these are the things we go through the engineering controls. Additional engineering controls are not recommended for workers in the lower exposure risk group. Employers should ensure that regular engineering controls, if used, continue to function as intended. And that's like saying that the carpets, you don't want them tripping over things. You have to have cleared hallways, etc. So for those of us, we really don't have to change much in our workplace at all. Administrative controls, we need to make, for this category, we need to make sure that we are communicating everything about COVID-19 recommendations. And we do have this, we have all of this put up on our bulletin board that's available to read. And in addition, I think the education and this presentation itself is part of the administrative controls in the low risk category. And personal protective equipment, additional PPE is not recommended for workers in the lower exposure risk group. So if you're coming to work and you're sitting in your office, you really don't have to use any extra personal protective equipment as long as you're 6 feet away from someone else. Now, if you want to use personal protective equipment, if you want to come to work in a mask and you want to wear gloves, that is perfectly fine with us. We are not going to stop you. Now, media exposure risk jobs, these would be, again, those giving allergy shots or those coming into contact with the general public or the medical assistants helping us. So engineering controls is to install physical barriers. Again, an example of that would be like our glass front window check-in. If patients were to come in the waiting room, as of right now, no one's coming in the waiting room. But once we start opening up, we do have our glass barriers. Another thing shows plexiglass. If two workers are within 6 feet of each other, we will provide plexiglass. So, for example, at the front reception, we will have a barrier between the two front desk workers. Administrative controls, well, and under this comes safe work practices. So, we will be providing face masks, and we do want you to wear face masks if you have to come in contact with the general public. Screening questions for anyone coming in. Well, they have these we have these posted on our front door. In addition, we also, the hospital screens people as well before they come in. Minimizing face-to-face contact, and we certainly are doing that with a lot of phone communications. And this just shows the restaurants how they're doing it. They're not seeing people in the restaurant. Instead, they're just doing takeouts. And it says that a workplace for medium exposure risk should have availability of medical screening if needed. This includes nurses, availability to a nurse, or telecommunication availability, like telehealth. If someone were to get ill on the job, they could call their doctor. Well, we have plenty of doctors and nurses in our facility and advanced level care practitioners, so we have that covered. Personal protective equipment. Again, in the medium exposure for any, we will supply you if you have to deal with the public, if you want to wear gloves, if you want to wear a mask, if you want to cover your face, we have all of this protected. Although I don't think it's necessary. If any of you, when you come to work, you want to put on one of those Tyvek suits, we have plenty of them, and it would be overkill, but they're available for you. Now, those in the high exposure category, that's pretty much just Jeremy and myself. But what we have done is we've sealed off this the area where we are going to work. We have all sorts of signs everywhere, and Jeremy and I are educated on the COVID precautions. We will have plenty of Purell and washing our hands a lot. We have those all over in the isolation room. And again, personal protective equipment. I actually had to go into the operating room and do, whenever we do high-risk procedures on someone with the nose and the throat, and we do not know their COVID status, we have to assume they have it, and that's where I am wearing, respirators and things. So you all need to, can be reassured that I myself am wearing all of this because I don't want to get it. And because I'm doing that, there's almost no risk that I'm going to be able to pass it on to you guys. So for more information, you know, there's the websites here. It's just www.osha.gov, www.cdc.gov, and they also have the NIOSH website. So I would encourage all of you to go to these websites if needed, so that you can learn more about this. Or if you also, you can ask Jeremy, myself, Missy, or Dana any questions. And if we do not have an immediate answer, which I'm pretty certain we will, but if we don't, we will find that answer out immediately. Okay, so hopefully this presentation is put together, number one, for education, and number two, so that this can alleviate some anxiety and some concerns, or maybe even some false ideas that anyone may have regarding this. Okay. Thank you very much. And, you know, I will be putting together a little questionnaire so that y'all can take it and just make sure that it reiterates and that you've taken home, that you've gotten all the take home points from this. Thank you.